Our next speaker is another old friend, Dr. Hugo Sachs. And, how many of you have seen the movie The Sound of Music? I'm sure you have. It's a well-known movie. And when I first met Hugo, I'm sure I saw him in that movie. But anyway, it turns out that he's a great scientist. He has done so much work. And in fact, the 5 moments, he's the one who first published it in the literature. And I hope also he will comment on the question we threw out just now, that the great complexity of activities in a ward, and often you need to speak of behavior paradigm, and basic theories behind human behavior. And I'm sure he will touch on that because I remember sitting down and we spent hours discussing it, right? So anyway, ladies and gentlemen, shall we welcome our speaker? And the topic is human factors design. Ladies and gentlemen, Dr. Hugo Sachs.
Thank you, Sito, for the nice introduction. I'm really glad to be here and talk about human factors design, something that I had the chance to learn and deepen last year. And I think it's very important for infection control. But let me start with giving you a warning. Listening to this talk might result in addiction and frequent hilarious observations. And actually, if that happens, if you get addicted, I have achieved my goal today. I would like to divide the talk in 2 parts. The first part being as human factors as a field, because this is something I ignored, and maybe you as well, that there is a whole culture talking and knowing about this human factors field. Let me start with talking some about the roots of this movement and this field. It goes back to the beginning of the last century. A couple of psychological industry psychologists came up with the idea to look into bricklaying. That was something that was very common at the time. Every building was made by bricks. And they really studied bricklaying in detail. They went on the construction site and actually timed it. You see the clock up there measuring milliseconds, and they achieved the following. They brought down these manipulations to actually put the bricks on the wall from 15 movements to 5 movements. And this was reducing the time, and they did this by what Andreas called system change, what we now know introduce in hand hygiene. They ordered the bricks instead of putting it on a heap, and they put it in a way that you could grab it easily. You can see here how the hand goes underneath the brick. Then the whole movement also came over to Europe from the States, and an architect in Frankfurt came up with a new kitchen design to speed up and facilitate the work in the household. So she did the same thing. She measured exactly what happened during the housework and timed it and analyzed the tasks, and then redesigned the whole kitchen so it would really fit the work. So here you see the old way, the old kitchen, and you can see in a moment how difficult it was to this work. And then she came up with a new design by really cutting it to what housewives have to do at the time. And you will see this in a moment. Everything is designed in a way that you could pick up things easy. And even if you sit down, you could sit down to work. And as you see in a moment, there was a nice way to get rid of the waste. And she even made a layout, a geographical layout of where the housewife had to walk, and it was a long way when the design was not very good. And then she brought a new design and measured the meters housewives had to walk, and by this new design it was cut down. So this was one of the roots of human factors design, but really it came into play and really was invented, and interdisciplinary teams were built up to look into the design of airplanes during World War II. This was really a high-speed, very complex environment. And you can see on the left the Spitfire cockpit with these many handles and dials and so on. And they all of a sudden understood that they lost too many pilots and too many aircrafts because of the bad design of this cockpit. Because pilots got tired, they confused the levers and pulled the wrong lever at the wrong time in this very difficult environment. And you can immediately see and compare this to the pictures we saw earlier this morning of an ICU, for example. So time going on, in fact, human factors got applied to many fields, and there is a huge body of research and results about how to design things they fit better the task. There is a human factors society with 4,500 members and many technical groups, and one of the biggest technical groups is actually healthcare. Infection control has some people already working in this field, but not many. There is possibilities for education coming up now. And this brings me to the second part, to some examples and some principles that could be applied in infection control. And let me read this part on page 65 of the To Err is Human report of the Institute of Medicine. That goes back into 1999. Latent errors or system failures pose the greatest threat to safety in a complex system because they lead to operator errors. They are failures built into the system and present long before the active error. So imagine this, the error is not really happening only then when the healthcare worker really does the error, but the error is already there latent in the system because the system was not designed to fit the human being. This is also called the invisible hand, because when you look into it, errors always happen in the same situation. And this is the manifestation of an error that is hidden in the system. Latent errors are difficult for the people working in the system to see, since they may be hidden in computers or layers of management and people become accustomed to working around the problem. It's difficult to see them. Now, this was 1999. Now, about 10 years later, we will listen to a proficient designer in a well-known design firm. They went into the hospital to redesign the workspace. A very good idea, I think. That's what he said.
Nurses are really good designers, far better, frankly, than a lot of the people that we brought into the room. And the reason they're good designers is because basically everything is against them. The world has been designed against them. They have to undesign all the things that we put into the system. And they're doing it all the time. They're working around the system and designing things.
So he's talking about nurses being good designers because apparently, even 10 years later, the system hasn't been designed as good as it should be, so people in the system are really helped by the environment and the tools we have at disposal. And I think the main issue here is why we don't see these latent errors is because we as human beings have something that is very difficult. We cannot see ourselves really in the system as seeing at the same time our environment, ourself, and the task at hand. And an example here is when you are hooked on Facebook for an hour and only afterwards you realize that you were bent down somewhere and have a terrible backache. You don't realize it because you're focused on your task, checking on all your friends' posts in Facebook. And this is a default on awareness, and this is also a call for action that I'm doing here, that you look at your environment and you really analyze it, and you're not just working around the problems that the system puts in your way. So in the human factors field, this is called the human machine model, and what the machine is could also be the environment or any tool. And usually machines are tend to be designed to a machine logic, and then the human beings have to adapt to these machines and learn how to manipulate the machine that is not really fit for the human being. So the idea here of human factors design is to look at the whole thing as one system. And what is the task at hand? You have the machine, you have the human being, you have to know about how human beings function, where you tend to forget things, where you tend to fail, and then design the machine in a way that it compensates this, and that the information flow through the system and through the human being is really as a one is a good system. There must be a good fit between the two. So this is about, the design task is about the process at hand. The process must be well designed, the tools must be well designed, and the environment must be well designed, and all cut to what we, how we function as human beings. So let me give you some examples here. First one is an easy one, shaving. And nowadays, shaving, the shavers, there is no problem anymore, but there might be some problems in the environment. That's what I see when I want to shave in the morning when I wake up in a standard hotel room. Here, the environment design is really difficult for me for shaving. Now, there is another little thing, and this is going really into what, when you start to think about this, you really get hooked up and see everywhere these little design flaws. The day before yesterday, I took a picture of a nice coffee machine close to our offices. I really like it. It makes nice coffee. But the design is awful. And I'll show you two design flaws in this machine. And there is this idea that when there is a design flaw, people, as we heard before, they try to find a workaround. And you see or to do patches, you fix it up somehow. So the first design flaw is that on top there is the price and there is the money you put into the machine will be displayed on this little display. And then always when I watch people approaching this machine for the first time, they try to find where the money goes in, and they looked for a slot close to the price. And that's how we work. We think if there is the price, money, then we put in the money there. But for some reason, for some machine logic, because they didn't have the